with industrial action, where the Nigerian Labour Congress has issued a 7-day ultimatum to the federal government to reverse all perceived anti-poor policies. The NLC frowned at the recent increase in the price of petrol, calling on workers nationwide to commence an indefinite strike next Wednesday should the government fail to reverse the policy. And this is as the Nigerian Association of Resident Doctors begins a strike after several attempts to get the federal government to solve their unmet demands. This recent strike comes despite interventions by the Secretary to the Government of the Federation and the Speaker of the House of Representatives. And health correspondent Kemi Balogun has more details.
Once again, patients who remain at the receiving end suffer the brunt of several strike actions undertaken by healthcare workers. Longer waiting hours and almost empty waiting halls are now the order of the day across some hospitals who have gone into full strike mode, like the National Hospital of Abuja. Patients here, like Ejoro, say despite the strike, the hospital services are still effective.
There's nothing special about it. There was no delay.
Spokesman of the hospital, however, admits that most of the services have been hampered due to the strike. He highlights what needs to be done to ensure that hospital effective service delivery is not affected.
The body, the national body, what they are saying is that government should make an attempt to at least pick one or two from their demands, and if that is done, they could negotiate the remaining demands from them, and then they'll go back to work.
Resident doctors have gone on strike more than 170 times in the last 10 years, constantly taking a toll on patients. This recent strike action comes after a 2-week ultimatum had elapsed on the 19th of July due to some unanswered requirements by the doctors. The strike, which started at 12 a.m. on Wednesday, was declared as a last resort after a few ultimatums, appeals, and several engagements with the federal government took place over the last couple of weeks.
We had meeting with the SGF, we had meeting with the Speaker, House of Rep, and promises were made. But since we had the meeting with them, nothing has been done, nothing positive has come out from that quarter. And our members are agitating because what we went on strike for is something that should be done as fast as possible. It's something that we can no longer wait for. We've been waiting and it has really affected us.
There has been no reaction yet from the Ministry of Health as at the time of filing in this report. Kemi Balogun, TVC News, Abuja.